Hi, I'm Kim Palmer. I'm the Social Work Intern Coordinator for UAMS at the Psychiatric Research Institute. We're invested in our interns here at PRI, so we've decided to have paid internships. I want to help shape your social work skills and to become the social worker you want to become and the social worker that we're ready to hire at graduation. We have lots of social work opportunities, from working with adults inpatient and outpatient to children inpatient, outpatient, and in the school setting. Let us tell you a little bit about us.
I think what drew me to social work was kind of a twofold thing. One, as a social worker, you have access to a lot of different types of jobs, so you're not easily pigeonholed into one area. You know, at UAMS alone, there's medical social work, there's mental health social work, so it's a variety of jobs. And in addition to that, social work was in line with my values as a person. And if I have to work my whole life, I'd like to do something that's in line with my values and the idea of helping people and common humanity being important.
So I'm always interested in what people's stories are, kind of where they came from, the experiences they've had, and how that impacts who they are today and kind of what we need to do to be able to help them.
Oh gosh, it's always the most cliche answer, but I wanted to help people. I wanted to be in a helping profession. And I got my bachelor's degree in social work, so a master's degree in social work was kind of the natural next step for me so that I could do direct clinical work with people and help them.
As a young person, my family really wanted me to go into nursing. I did. I became an LPN, started back to school as to get my RN, and in the meantime, I had been working for a physician and watched many people come in with substance abuse issues. Benzos were ordered pretty regularly. We ordered lots of oxycodone, as you know, and opiates, and over time, I saw many people become addicted to these substances. In the meantime, I started working in the social work field for my field placement, saw many people in recovery. Many people come in very broken, lost families, lost children, out of jail. And over time, it was so rewarding to see so many people get their lives back on track, have very successful lives, go on to college, have families, and very, very successful. This has been very rewarding over my last 30 years, and it's one of the reasons I'm still in the field of substance abuse, just because of the tremendous, tremendous milestones we've made working with substance abuse clients.
The first time I was exposed to a social worker was I was in middle school. My brother was in elementary school and he had cancer, and he was treated at St. Jude in Memphis. So we were exposed to the social worker. I thought she was kind of neat because she helped our family, and even though it was a hard time, she was real funny, had a sense of humor. I remember she would help him make video games to shoot the cancer cells, and I thought that was kind of creative. Didn't think about it for many years. I actually have a minor in geology. I thought I was going to be a geologist. And then when I took sociology classes and psychology, I really liked those and changed my major. And then when I had a degree in that, I learned about social work, so I got a master's. And then I've been in the field ever since.
I actually pursued social work as a second career. I was working previously in advertising and I didn't really find it to be meaningful work. And so I started to really look at my values and the things that I wanted to do in life and realized that social work aligned with that. I really enjoy getting to meet people, finding out kind of the ins and outs of their relationship dynamics and being able to just sit with them in times of need. Social work's kind of philosophy about meeting people where they're at really strikes a chord with me, and so I just love getting to work with people.
At the Child Diagnostic Unit, I'm the inpatient therapist, but I'm also a family liaison. And what that means is that I'll do individual and group therapy with the kids on the unit, but I'm also the one that will do contacts with families, let them know how their kids are doing, discuss things like diagnoses and symptoms, talk about ways that parents can help their kids once they get back home, help them connect to resources within their communities, and just generally be there for them while their children are away.
I'm a licensed social worker, and so I provide mental health services. Strive specifically works within the North Little Rock School District, providing mental health services in school settings to various elementary school, middle school, and high schools in North Little Rock. I work at the North Little Rock High School campus, and I provide services to teens and families in that community.
So at the Crisis Stabilization Unit, we do assessments. So we meet with folks and we get information about what's brought them to the crisis unit. We get background information. We put all those pieces together to see what we can do to help them in whatever crisis situation they're having. We work with them if they're wanting to go to rehab, if they're having a mental health crisis. We work to get them connected with the mental health center. And we also work with them to give them coping skills, to help with relapse prevention plans, safety plans, whatever their needs are.
PRI has incredible opportunities in terms of internship. Part of what's wonderful about UAMS is it is a teaching university, and so it allows you to have that opportunity to still be in a teaching environment while you're gaining skills and practicing those, and having the opportunity to be surrounded by a wealth of knowledge. In the inpatient PRI acute hospital portion, you get to experience people who are in a mental health crisis. And you get to really see how psychosocial dynamics play out in someone's mental health crisis, and where social work needs are. Unfortunately, you may not be able to solve all of those, but you can definitely be able to point people in the right direction, and hopefully get them connected to some other resources once they're out of the hospital.
I interned at PRI. So my first half of the internship, I was at Walker Family Clinic. And then my second half, I was at Child Study Center. So I got a lot of experience. I started out observing, and then I kind of worked up to carrying my own small caseload. I was even able to co-lead trauma groups. And so I felt as prepared as you can, when you graduate school, and I liked it so much I'm still here.
The kids on our unit are there for a variety of different reasons. We've got children that have emotional diagnoses. We have children that have developmental diagnoses. We have children that have behavioral diagnoses, and they're all there so that we can help them learn to flourish in their environments, to overcome whatever obstacle it is that they're with us because of. And hopefully we'll get to see them down the road doing and living their best life.
An intern at PRI would have depending on if they were a first-year intern or a second-year intern, would have a small caseload of their own. They would get to learn evidence-based protocols and see them in action, whether it be by shadowing some of the best therapists here in Little Rock, or by learning and practicing some of those protocols that they've been learning about. They'd get to see a diverse group of patients with diverse diagnoses in an adult outpatient setting.
I was an intern, and in my final year of grad school as an intern at Strive, I had basically what I would call a mini caseload. Just like not a full caseload, but I had about 12 clients that I was responsible for seeing, and then I was supervised by my supervisor. So an intern at Strive, you may practice doing intake assessments. You may work on doing some individual therapy. You may work doing group therapy. And a lot of the time, at least the first few weeks, you're gonna do a lot of shadowing of an established therapist so that you get an idea of what's expected of you.
One of the things that I currently do is I'm the clinic manager for the Center of Addiction Services and Treatment, which still leaves me very involved with patients because I supervise all of our social workers currently, which is really rewarding because I get to pass on the things I've learned over the years and continue to watch patients as well as staff grow in the field. The other thing I really like about working here at UAMS is the diverse multiple team approach that we have with all the research going on, with all of the disciplines that we have, from psychologists to nurses to physicians to PAs. It's a real opportunity to get so many different viewpoints and so much feedback that I even continue to grow, even though I've been in the field for a long time. And that's what makes me keep coming back, the rewarding abilities that I have to continue to grow.
An intern on the child diagnostic unit would have an experience that I don't know that they could have anywhere else. The team that I work with includes a speech therapist, occupational therapist, psychologist, psychiatrist, psychiatric nurses, psychiatric techs, and they're all people that are passionate about what they're doing. We come to work every day and we are excited to play. We are excited to get to know these kids. We're excited to find out what it is that we can do individually and as a team to help these kids. And an intern would be able to come be part of that team for a while and learn what it is to work with the team, not only as a social work intern, but just as a CDU team member. And I think that they would get to try on a lot of different hats there.
My favorite part is the connection that you get to make with your clients. You work with people who come from all walks of life, so no one's the same. And it's just, I think in social work you get to build a connection that's really unique that you don't get to do in a lot of other professions.
I hope we've piqued your interest in the multiple opportunities at PRI for social workers. We're ready to help you hone your skills and become the social worker that you want to be, and ready to kick off your career in social work. If you have any other questions, feel free to contact me.